everyone. Welcome to our Take 10 chats. With these chats, we want to share experiences of healthcare providers from around the world that are involved in apheresis and explore how they're responding to the changing environment in light of the COVID-19 pandemic. So today we're joined by Dr. Ashok Raj, professor and division chief, pediatric hematology oncology, director of the Pediatric Comprehensive Sickle Cell Program for Norton Children's Cancer Institute, affiliated with the University of Louisville in Kentucky. Thank you for joining us today, Dr. Raj. We're really excited to talk to you and hear about your experiences.
It's a pleasure to be here today.
Great. Well, so let's start with, just in general, how has this pandemic impacted your department and your colleagues and the ability to treat your sickle cell patients?
I want to begin by expressing my concern for everyone during this challenging time. While this pandemic has impacted citizens of nearly every country, for patients with chronic conditions, the outbreak has been an increasingly stressful time. For patients with sickle cell disease, who have many complications related to their disease, what we refer to as comorbidities, predispose them with poor outcomes if infected with SARS CoV 2. Sickle cell disease patients are a high risk population at baseline, and we have learned from other viruses such as influenza that compared to children without sickle cell disease, the influenza related hospitalizations and deaths are substantially more common among children with sickle cell disease. There is a paucity of data with respect to COVID 19 in sickle cell disease, and data is being collected by the International COVID 19 Sickle Registry. The website for that is covidsickle.org. The pandemic we are experiencing is unlike anything that has happened in our lifetimes. Healthcare associated infections are a huge concern, including catheter related bloodstream infections in patients in the ICUs and oncology floors, and our sickle cell patients maintained on long term automated red cell exchange transfusions who have a central venous access device. Handheld hygiene was integral for reducing the rates of infection, and this important education was and should remain an ongoing process. Telehealth has already helped our patients seek care for non urgent matters and provides the perfect opportunity to limit exposure for patients and healthcare staff alike. Plus, these remote visits have eased the burden on our hospitals and emergency rooms. I believe these virtual methods are here to stay. We offer many therapies to our sickle cell patients which are directed towards their disease. And one of that such procedure is erythrocytopheresis or automated red cell exchange transfusions.
And so with those different options that you just mentioned, how has this pandemic affected the ability of your patients to receive those therapies as they would have normally? As you said, they're at high risk or at baseline, and then with the pandemic, they're at even higher risk. So, just how are you managing that flow to make sure they're getting the treatment that they need?
In early March, the Red Cross saw a critical shortage of blood donation nationwide. This lasted approximately 1.5 weeks. We made changes to our transfusion program and substituted the automated red cell exchange transfusions with simple transfusions as the indications allowed. But blood supplies quickly rebounded, and we were able to provide services to all patients.
Great. And as you just mentioned, the blood supply, we had a global blood shortage, and I think around the world it's still continuing. So what have you learned from that in the past experience? And how can you apply that in case this happens again?
We have an excellent transfusion medicine program who have served us really well. And we are very fortunate to be located in the Midwest region of the United States, where the blood supply has been better than the coastal regions. Whenever I had to put a patient on automated red cell exchange transfusion program, I've never had any pushback from our transfusion medicine department. They have been excellent and have served our patients very well. Now, I want to say a few things about automated red cell exchange transfusions. There are two ways to transfuse a child with sickle cell disease. One is a simple transfusion, where you give someone else's blood as an IV infusion, or you exchange the patient's blood by reducing the total hemoglobin S, but not raising the total hemoglobin. So with this, you dilute the sickle hemoglobin or hemoglobin S without raising the total hemoglobin. As a result, you don't cause iron overload or minimize iron overload. So many of our patients maintained on long-term erythrocytophoresis do not require chelation therapy. Chelation therapy is one of those treatments wherein you get rid of excess iron in your body. So we have made every effort to try to make sure that patients stay on the erythrocytophoresis program. And like I mentioned, the shortage lasted only about 1.5 weeks in early March. And since then, we have not experienced blood shortages and have been serving our patients well.
Great. And as you just mentioned again, digging a little bit into the red cell exchange and um, how has the pandemic affected your your allied health, such as your nurses and the operators of these devices, and what changes have they had to make with this pandemic?
We had to make changes to how we were working. The clinical staff were classified into essential and non essential. The non essential were moved to remote work schedule. All gatherings greater than 10 persons were suspended. All meetings were held remotely. All patients on active treatment protocols continued to receive their treatments, and non essential studies were suspended. Although doctors and nurses have gotten much of the attention in the past few months across the United States and the world, healthcare workers understand that every link in the chain is critical in patient care delivery. The Environmental Services Department at Norton Children's Hospital has always done an exemplary job. Infection control, sanitization, and cleanliness was always top of mind for our hospital. And now it is more important than ever. We are taking a closer look to elevate the various processes to make the environment cleaner. One of the realities, as far as children are concerned, were the restrictions placed with the new visitor policy, which put a strain on patients and their families. Children were more likely to feel scared, and it was often difficult for physicians to develop a closer relationship because they were functioning not just at a physical level, but had to do so at a deeper emotional level. Previously, these restrictions had limited exceptions. Now, the policies are starting to be a little more lax.
After experiencing some of these changes, what else do you think that the industry can provide to help support you and other physicians and patients to make the experience better?
Companies can launch a patient financial aid fund that gives assistance to patients who have been financially or adversely affected by COVID 19. We are doing our part. The Norton Children's Hospital Foundation is engaged in patient assistance programs. These include financial assistance handled by care management, food pantries, and assistance to the telehealth program. Just as our nation strives to answer the COVID 19 virus, we should together continue our mission of research for finding new therapies and cures for sickle cell disease by harnessing the emerging technologies. Under the supervision of our physicians, our patients receive care at a world class medical center, along with the chance to participate in clinical trials at the cutting edge of medicine science today. We need to continue that.
Absolutely. And you mentioned earlier something about, telehealth and how much that's impacted and aided in your ability to treat patients and, keep the safety between the patients and your staff. Can you touch a little bit more on that and what you see that being in our future?
During this pandemic, telehealth is no longer just a nice to have, but instead a must have for patients and healthcare professionals alike. Many diagnostic tests are done closer to the patient's homes to limit exposure for patients and healthcare staff alike. Surveys have shown that more patients are likely to use telehealth services moving forward than previously, and many would even leave their current physician for a provider who offered telehealth access. Telehealth is experiencing a significant momentum and growth and will have a vital role in care delivery in the future. Telemedicine has also allowed to reduce the flow of foot traffic in our patient offices.
Absolutely. And is there anything else here that we didn't cover that you'd like to share with your peers or others who might be seeking advice in this unprecedented time?
Yes, though these are challenging times, we are proud to step up and work together as a united team supporting the health and well being of our community in general and sickle cell disease in particular. That feeling of togetherness we have cultivated will also provide us opportunities for growth and learning how to do things better and be proactive and prepared for situations like this in the future.
Absolutely. Well, thank you so much, Dr. Ash, for joining us today.
Thank you.
And thank you, everyone, for tuning into our Take 10 chat, and we'll see you next time.